here. Welcome to the continuation of our Food and Faith series. We have an exciting speaker and topic today to share with you. We are grateful that we have continued our virtual offerings and that you all keep showing up. So thank you for joining. I know that I know I'm not the only one who feels like they're on Zoom still through the pandemic, but it helps us see you all and stay connected. And for that, we are grateful. I am going to give a welcome on behalf of PHW. I'm Jessica Stokes. I am one of the associate directors. I lead our statewide mental health efforts. So I work with faith communities across the state on mental health, eliminating stigma, normalizing professional therapy, incorporating trauma-informed ministries and efforts into the life of your church, and suicide prevention and all types of trainings that we are thankful to have professional collaborations with. So that said, if you are working on mental health or anything related to that, please reach out to me and I'll put my email in the chat here momentarily. But for all you new folks, perhaps you maybe don't know about PHW, we work on all types of things, from harm reduction efforts with our overdose response program to healthy eating, physical activity, freedom from nicotine and vaping, to all type healthy aging. So please consider the ways that PHW can work alongside you and your church and your health ministry to bolster it and support you all, because this is hard work and we want you to feel connected because we have tremendous resources to support you in. So that's Partners in Health and Wholeness, and we are glad you're here. So if you will, please join me for a moment of peace and prayer. God of hope and love, I give thanks for today. I'm thankful for this virtual space where we can gather and learn about ways of being whole, connected, and practice shalom and flourish through your love, God. Taking care of our bodies and our minds and our spirits helps us better take care of our communities. By taking care of ourselves, we can then have healthier faith communities and healthier families and healthier lives overall. And for all that, we ask your help. We pray that you will support us in these efforts, even when they become exhausting, when they become it just feels like it's not working despite we're trying everything, when things become complicated with relationships within our churches, and we're just trying to show up the best way we can. We ask for your support, God. We ask for your guidance. We ask for your discernment so that we can promote health and wholeness in the ways that you want us to, God. And we also give thanks for Kim and her work in the world and all that she is doing to help people like us accomplish this, God. So I give thanks for every person on this call, and in all this we pray in your name, amen. So Kim, we are so excited that you are here. Thank you for joining us. I will allow you to introduce yourself, but I want to give a warm welcome to Kim, who is here with us today for our Faith and Food series. Thank you, Kim.
Thank you, Jessica. Good morning, everyone. Thank you so much for being here. And thank you to Partners in Health and Wholeness, to Nicole, and to all of you for the invitation and the warm welcome. I am always grateful to be in these spaces and come away with new knowledge and inspiration. So I love being here, and just thank you for the opportunity to share a little bit about our work with faithful families. I am going to take just a moment and share my screen, and I'm terrible at doing two things at once. So get that up. Okay. So my name is Kim Eshleman. I am the Faith Communities Liaison for Steps to Health, which is NC State University's SNAP education program. and I support the Faithful Families Thriving Communities program. And I'll talk more about the program as we go along. But briefly, Faithful Families is a program that works directly in communities of faith across the country and really across North Carolina to promote health for individuals, families, and local communities. And the program is open to all faith and religious traditions and backgrounds, and really engages faith communities in health education, but also environmental changes to support health, as well as community-wide health initiatives. And so our purpose is really closely aligned with that of Partners in Health and Wholeness. And we're really grateful again for the invitation to be a part of this series, which has been incredible so far. And we look forward to ways that we can continue to partner with Partners in Health and Wholeness, with the North Carolina Council of Churches, and most importantly, with you all in your congregations and the communities that you serve. So we are a federally funded nutrition assistance program, and so I always have to post our disclosures and regulatory requirements and just let you all know that we are an equal opportunity provider. So when Nicole invited us to participate in the series, we were initially thinking about, because it was March, the ways to tie our theme in with National Nutrition Month. The timing turned out to be a little bit different, but I think it's really a good place to start. As a program that focuses on supporting communities in their efforts to ensure access to healthy food, but also places to be physically active, and also working together to support the ultimate goal of improved health outcomes, we spend a good amount of time thinking about nutrition. It is really embedded in our work, but it isn't the whole story. And I recognize that this word nutrition can also be a really sort of loaded word sometimes, with varied meanings, connotations, and feelings that arise for different people in different contexts. It may also be a word that you all don't think about that's top of mind for you if you work outside of this field. I know that many of you are probably in ministry, and so maybe nutrition is not a word that you think about on a daily basis. But food really does play a central role in all of our lives. It sustains us. It's a central piece of our gatherings. And so I think it's important to take a few minutes to consider how we think about this idea and this word nutrition. I should share here up front that I am not trained as a nutritionist or a dietitian, though I work with many wonderful colleagues who help to create our curriculum and create the interventions that we rely on and the resources and who keep us on track. I am a word person, however, and so I want to know, when you think about the word nutrition, what comes to mind for you, whether that's a feeling or a word or a definition? And I'll give you a couple minutes to respond. If you want to come off mute, that'd be great, or drop it in the chat. But just what's a word or a feeling or that comes to mind? Oh, hi, Natima. Natima is a colleague of mine, so I'm glad to see her here. And she teaches nutrition, so health, vital. Oh, I like that word. Energy. Those are all really great answers. Fruits and vegetables. Yes, we talk a lot about fruits and vegetables. Happiness. Yes. I love food, so I can identify with that word, happiness. So nutrition, as defined by dictionary.com, means the act or process of nourishing or being nourished, the use of food for life, health, and growth. And so I think really framed this way, perhaps nutrition and food can really become something that's a bit more familiar to us in a life and in a community of faith. So this idea of nourishment, sustenance, and life are all, those are all ideas that we're very familiar with when we think about life and communities of faith. So I did a quick Google search using the term nourish, and pictured on this slide are some of the images that I found. And I thought it was really interesting that many of these images returned for this word nourish focused on a holistic picture of wellness. And actually, many of the images that were returned involved people serving others. Foods that we think of as healthy, fruits and vegetables and grains and things like that, were certainly part of the picture. But this idea of nourishing is really much bigger than a simple meal. And I think this can provide really important context for understanding how faith communities might be a really powerful place to talk about nutrition and health. So, food as nourishment for mind, body, and soul is central to sacred stories from many, many different faith traditions. And it's also the center of many of our own individual and family stories. I am sure that many of you could tell stories about meals, of favorite dishes and gatherings that you have. And I actually would love to spend all day sharing those stories if I had a choice. But I know that you all have them and that you share them with one another. We get nourishment from our gardens. We get it from the shelves of our local grocery stores, from our pantries, and our lives are really enriched not only by that food, but by the people who we share our tables with in our homes and in our faith spaces. We also sustain our communities and live out our calls to service when we help to feed those in our communities who are hungry. So food really is much bigger than this idea of just simply nutrition. I love that, Natima. She says, nourish the body while socializing to feed the soul and learning from each other to enrich the mind. That is a perfect summation of what, what we aim to do with Faithful Families. So thank you for that. And so I think a focus on nutrition, while it may not be top of mind for us when we think about ministry all the time, may provide a wonderful opportunity for people and communities of faith to reflect on our stories of nourishment and to think intentionally about how we nourish ourselves, our families, and our communities. And so in our Steps to Health program, we like to say, how can we help support families and communities make the healthy choice the easy choice? And so with this in mind, I want to talk a bit more about Faithful Families, about our vision, and how we might partner together to support health in your congregations and your communities. So a very brief history of the program for those of you who may not be familiar. Faithful Families was developed in 2007, so we've been around for quite some time. I have not been with the program that entire time, but I have for the last number of years. And it was developed as a partnership between NC State Extension and the North Carolina Division of Public Health. And this group of folks really wanted to create an interfaith program. And so they called together over 40 state and local stakeholders and leaders, both from religious communities and from health organizations. And these partners gathered together to advise the planning and the implementation of what was then a new program called Faithful Families throughout the pilot phase. And there were several priorities that emerged from these stakeholders and the interfaith panel of experts who reviewed the program. And the first was really the importance of connecting a community's faith with their efforts to support health. Secondly, supporting communities that experience the greatest disparities. And finally, ensuring that the program is adaptable to any religious tradition. And so these principles really were then and continue to be guiding principles and integral parts of the program. The program was initially called Faithful Families Eating Smart, Moving More, and that was to reflect its primary focus on promoting healthy eating and physical activity. However, over the past number of years, the program has grown to really address the diverse needs that we have seen present themselves in communities, as well as also the assets that have emerged from faith communities as they're doing this work. We still focus on that healthy eating and physical activity, but the focus is a little bit broader now. And so the program has expanded local and national partnerships across public health, practitioners, and researchers. And in 2018, we changed our name to Faithful Families Thriving Communities to better reflect the mission and the vision of our organization, which really encompasses that broader mission to address the holistic health of individuals, families, and communities. So Faithful Families is offered in about 20 states across the nation, give or take, and also throughout North Carolina, throughout all locations in North Carolina. And North Carolina really is our flagship program. And our vision is that we really believe that communities of faith are important health advocates, particularly in those communities who are affected by health disparities, or who lack crucial resources to support health. And so our aim really is to come alongside and empower faith communities to become change makers to help their broader communities thrive. And that's physically, but also mentally and spiritually. In alignment with that mission and vision, in the last couple of years, we have strengthened our partnership with Steps to Health, which I mentioned before is NC State's SNAP education program. And this gives us resources and the ability to really prioritize those communities who may lack access to adequate resources or who may be facing inequities that are systemic that create barriers to health. So we work to accomplish these goals through nutrition education, but also through thoughtful planning and implementation of changes that can help community members make meaningful and sustainable changes in the long term. So policies and changes to the environment that can help support that work. And we also try to help connect communities of faith with clinical support resources and other community resources that help them build and strengthen that partnership to support that work in the long term. And so we talk a lot with our agents and our educators about this, but I think it's also important to share with you all who are present and working in communities of faith and who may already be doing this work and asking yourselves a similar question or thinking about this. Why work in faith-based health? We are not the only ones working in this space, and we know that the efforts are being made across the state and across the country and other organizations. And so we think about this a lot. Like I mentioned before, our vision is centered in the belief that faith communities are positioned to be those change makers in their communities, and we really want to come alongside. And so we know that faith communities have tangible and intangible assets. And I know that you all know this, but tangible assets, faith communities often have buildings and spaces that can be utilized in this work. More importantly, I think faith communities have people, and they have people who really care deeply for their neighbors. They provide a source of moral support for their congregation members, but also their wider community, social support, and often they really have the power to shape and form social norms, both within the congregation and outside of it. There is a natural emphasis on healing in many different faith traditions, and an emphasis on the whole person, so mental, spiritual, and physical health, and how all of those things connect to promote well-being. And so there's a natural connection between faith and health that can be utilized. Also, expanding the reach of programming of organizations like Extension, who we work with closely, but also your local health departments and other community organizations on the ground. And that can be particularly true in hard to reach communities with limited access to those resources. So rural communities, small communities who may be overlooked by bigger organizations. We had an example early on in the program in West Harnett County where we conducted asset mapping workshops, and faith communities were identified as the most trusted partners in those workshops. And so we know that they have great power to influence sort of those ideas in their congregations and beyond. So how do we accomplish this in partnership with faith communities logistically? There are three core elements to the program, and the first is direct peer education. And so we do have a 9-lesson curriculum, and that is co-taught by facilitators and then a lay leader or lay leaders within that faith community. And that 9-lesson curriculum focuses on nutrition and physical activity, and is really heavily discussion based. And through those discussions and things like recipe taste tests and other activities, individuals and families are really encouraged to set goals for building healthier lives for themselves, for their families, and for their community. I cannot overstate this. Lay leaders play such a critical role in this program, and they work alongside that facilitator to plan and implement these direct education pieces. And they bring those faith elements into the lessons and discussion. And so our facilitators rely on them to bring what is meaningful to their communities because they are most in touch with that and understand what those traditions are. So things like sacred stories, readings, prayers.
Hey, Kim, you're muted. Yeah, you just got muted a few moments ago.
Oh,
Yeah,
sorry.
no problem. Just wanted you to know. There you go.
Thank you. I don't know how that happened. That was strange. So I'll back up just a little bit. I was just talking about how lay leaders play a really critical role in this program. They bring those faith elements in ways that make sense to the group through sacred stories, through prayers, readings, and things like that, and really have the ability to make that connection between faith and health for their unique community. We don't leave lay leaders hanging. We do have resources and training that's available for those lay leaders, and we're continually developing resources to try to support that work because we know it can be very difficult to step into something, even if you have a passion and a desire to do that. So we want to make sure that we're supporting lay leaders in that role. Throughout the program, the facilitators work with each individual faith community to think about their priorities and their assets and strengths that they bring to the table to help affect change and to promote health in their community through things like policy changes and environmental changes that can have a positive impact on the long-term health of their congregation members. Facilitators help support those needs and those efforts, but the efforts are really guided by the community's needs and their interests and their desires. And so we don't prescribe solutions, but we really try to work together to help communities identify those changes that make sense to them. And those might be big changes, but they might also be small ones. And so, for example, we might think that community gardens are the best way to improve access to healthy food in a community. But if that solution doesn't arise from the needs and interests of that unique faith community and their leaders, then we know it's less likely to be successful. So we really are here to serve as a connector to those resources to help facilitate discussion, but the faith community really drives the change, which can be really exciting to see that emerge over time. So as the program progresses, facilitators help to connect faith leaders and their communities to other clinical supports and community resources and programs that can help them continue on this journey, whatever that looks like for them in their next step. Faith communities, we know, can also continue this work, and many of you may already be doing this, by participating in local coalitions that are addressing health needs and using their own particular resources and strengths to support those wider community health initiatives. And we have seen that happen over time with lay leaders and faith leaders to really step into that work after developing a passion for supporting health. And so I want to touch briefly on a few stories of success that we have seen over the years. We really talk a lot about small changes and a big impact. And so this doesn't have to be overwhelming work. Communities we've seen commit to serving water at gatherings, or perhaps it's serving a healthy option, a baked option, or fruits and vegetables alongside their more traditional dishes to give people that option. And we've seen communities sort of incorporate this into their formal church policy. But we've also seen them work with the committees that support their fellowship efforts or their meals to just naturally bring that about as something that they commit to as a community. We've seen outreach opportunities identified. So promoting physical activity in the congregation and in the wider community through creating things like walking trails on their properties, incorporating fitness into worship. We've seen that in a few communities, or adding messages about healthy eating and physical activity to written materials, whether that's a worship guide or your newsletter, something like that, or even messages from the pulpit. We know that clergy and faith leaders really can influence that messaging. And so it can be a very powerful thing to add that message coming from the pulpit. We have seen churches and faith communities offer fitness classes in their communal spaces like gyms or their fellowship halls, and opening that up not only to their congregation, but to their neighbors. Another thing we have seen over time is faith communities working to open their spaces. And I know this is a conversation that's happening across North Carolina and other states across the country within denominations. I've been hearing a lot about how we can utilize our space in the best way. So working with the community to develop a shared use agreement to use things like playgrounds that are not being utilized during the full week. And so that's something we've seen over the years as well. We have also seen faith communities establish partnerships through local coalitions. So lay and faith leaders becoming involved in those community coalitions, developing wellness councils both within their congregation, but also joining those other broader efforts in the community. Addressing food access by establishing food pantries or working to bolster the models that they're using in their food pantries that already exist, partnering with regional food banks, and of course, building community gardens on church property. We've seen that sort of proliferate over the past few years. One church early on in the early years of the program noticed that there was a need for a farmer's market space that their neighbors would feel comfortable going to. So what they were able to do was to establish a farmer's market on their property. And that was something that was sustained and expanded even after the program was over the years with outside funding opportunities that they were able to leverage. And so it can really be anything from small to large, and it can we really want to work on the long-term impacts with faith communities and what they really envision is a need for their communities. And one of the things I want to particularly highlight here is something that we consistently hear from facilitators and have heard directly from clergy and lay leaders who've been involved in the program is the importance of the social connections that are developed through the program. So participants really have a chance to engage in discussion and to support one another in implementing these changes. And they often report that some of the most enriching pieces of the program are the ways that gathering together over this period of weeks and sharing stories, learning together really helps them to build and strengthen those relationships and to support these changes in the long term. We know that 9 weeks can be a long time to think about giving up time and space in faith communities. But really we hear a lot from people that once they've come to 1 or 2 classes, they really just want to keep going. And so we think the social connection is a really important piece. And we know that that is something that is a widespread issue across our country now in the wake of the pandemic and really reestablishing those social connections. So we love hearing those stories. And so quickly, I want to talk about what might be next. This webinar series, I think overall has provided so much rich food for thought and some incredible resources. I know that you all have already heard from at least one extension person, and maybe there's another coming. Extension is an incredible resource for you. So I hope that you will find ways to reach out to them. The Faithful Families program on our website, you can find lots of free tools and resources. And once I'm done here in just a moment, I will drop that in the chat. You can also see it on the slide and my email address. But we really want to be here as a resource in any way we can. So I'll share a little bit more on those tools and resources page. There are guides for healthy eating and physical activity, some meal planning tools, that kind of thing. You can also find a link to our webinar archive if you want to learn more about our partnerships that we've developed over the years and some of the work that we've done in other faith communities. You can check out that webinar archive. You can also check out our blog for success stories and other tidbits of information and resources. Also, feel free to follow us on social media. We love hearing from people there. We are on Facebook and Twitter, and we try very hard to share resources and opportunities that we see there, and to connect you with resources with other partners like the Council of Churches, and others who are doing this work in the faith health space. We would love to help bring the Faithful Families program to your community if that's something that you're interested in. There are trained facilitators in most local areas across the state. Natima Drummond is here. She is an FNAP educator, and she is one of our trained facilitators. I'm so happy to see you here. We can connect you with one of those facilitators, or find someone who's interested in being trained to bring that 9-lesson series, and then the continued partnership with you over time to think through those changes that you might want to make to support longer term health. Finally, reach out, please do. We love to hear from communities. I will speak for myself, but also our program director, Dr. Annie Hardison Moody. She's not able to be here today, but we love hearing from faith leaders and lay leaders and clergy. So please, if you have any questions, reach out to us. You can find our contact information on our website. I'm also happy to connect you to the folks in your local extension office who really are incredible. There's lots of resources there. You can always reach out. If you Google your county name and extension, you should come up with the page for your county's extension office with a list of personnel there that you can contact and reach out to. If you have a local family and consumer sciences agent, that might be a first person to reach out to about Faithful Families, if you don't want to reach out to us first. But there are lots of extension master food volunteers and FNAP educators, and just a wealth of resources there for you to help with this work around food and faith and health. And so now that I have talked, I would love to hear from you all. This is my favorite part. So I want to hear your story. What is important to you about this work of faith and health? What are the needs that you're seeing in your communities? How have you been equipped to respond? I know that many of you are probably already doing this work. What would you like to do? And then how can we partner together? So I know those are lots of questions, but I'm happy to answer questions that you might have about the program, but would also love to hear from you about what you all are seeing and doing and needing. And it could be anything.
You, Kim. If y'all would like to unmute yourselves to ask a question or to share what your faith community is doing around healthy eating and why it's important to you, you can unmute yourselves to do that, or you can, put it in the chat, although I think that would be a lot of typing. But Kim has shared a lot of information here, so just let us know.
And I should say it's a lot of information, but most of this can be found on our website. And like I said, I'm really honest when I say I would love to chat with any of you. This is one of the things I love about my job. So
yeah, I know a lot of our faith communities have a healthy eat. They try to have like a healthy eating component. And can you tell us how we've got a couple comments, but can you tell us how we could connect more the healthy eating opportunities for children or for teenagers and incorporate that into whatever a faith community might be doing?
Yeah, that's a really great question. So the Faithful Families program is an adult education program, but the focus really is on creating those spaces for healthy eating and healthy, what's the word that I used before? Setting up those healthy habits for your family. And so there's a lot of good information in the program about how to incorporate fruits and vegetables in ways that are appealing to children. We know how difficult that can be. And those things can also be expanded out to the work that you're doing in your faith community. It's all really helpful information. If you're faith community has a preschool, or maybe you have a summer program, or you're one of the congregate meal sites that you're providing the summer meals for kids. I know that a lot of faith communities have been doing that these last few years. The Steps to Health program has a couple of programs that work with preschoolers and school-age children that could be options for you, particularly if you are serving an audience that is SNAP eligible, or at least partially SNAP eligible. So that's another thing we would love to connect with you about. If you have a preschool that's serving that audience, if you have even a food pantry that's kind of doing that work, that you're that's part of your ministry, or like I said, you're one of those congregate meal sites for students during the summer, I think that's another great way. And those programs really are geared towards educating preschoolers and school-age children in that. And that's something you could also, if you are in partnership with local schools in your area, recommend to them. And that is delivered, through our agents at the local extension office too. So I do think there's lots of valuable information in the Faithful Families program itself that you can then incorporate into your ministries with young people. I know that Extension is also working on thinking about, some of our programs are working on thinking in particular about that teenage young adult audience that we know is emerging as a very, very important audience. And so there are resources coming down the pipe for that. I think there's one program that's in pilot right now. So we know that is a big emerging audience, especially as they're coming into their own and moving out on their own for the first time.
Yeah, we have a question in the chat. How do you Google the county? And a question on how to find local extension resources.
Sure. So if you go to Google and whatever your county is, you can this is actually how I do it, because I don't know all the websites, but if you just say, like, I'm in Wake County, so I would say Wake County Cooperative Extension, or even just Extension, it'll probably be one of the top results that shows up. If you navigate to that page, and then there's usually, they're all very uniform looking in every county. And so there should be a tab there for meet our staff, something like that. That will take you to the page where you'll see all of the agents and the extension director. If you kind of don't know who to reach out to the county extension director. They can or the admin, they can connect you to the right person. There should be like a main number too that you can call and just tell them what you're looking for, and they can connect you.
Thank you, Kim. We had someone on the chat from St. Paul's Episcopal Church in Greenville, North Carolina. They're saying they have an on-site food pantry once a week, and they've recently partnered with Ripe Revival to bring local fresh fruits, veggies, dairy, meat, and pay as you can.
That's amazing.
Partners with local farmers.
I've heard a lot about Ripe Revival lately, and that's really exciting. It looks like an incredible program, and something that definitely a resource that we're keeping in the back of our mind to recommend to folks. So let's see, it looks like Lynn says, I'm the pastoral associate at Holy Infant Catholic Church in Durham, and we've had a food justice garden for a number of years. This year in particular, we're exploring new ways to promote healthy lifestyles, and our focus for the year is nourishing our bodies, souls, and communities. So this is valuable. Thank you. Thank you for that. I love that, nourishing our bodies, souls, and communities. That was this idea of nourishment to me was such an interesting study and putting together this presentation. It really gave me a lot to think about and contemplate. So I think that's a really great way to approach this. Oh, thank you. Natima says FNAP, which is the Expanded Food and Nutrition Education Program. For those of you who may not know, it's another federally funded nutrition assistance or nutrition education program. They partner with Ripe Revival Teen Cuisine, which is great for teens. That's an awesome resource. As a parent of one teenager and another almost teenager, I appreciate that, because getting them to make healthy choices is important, but not always easy. Oh yes, Society of St. Andrews organizes volunteers to glean at farm, and food is taken to food pantries and communities that are food insecure. that's an incredible, my personal faith community has partnered with them. And I think that's such a great, and a great opportunity for kids too. I think they take volunteers that are kids of a certain age to be able to get into the field and glean. So. Thank you all for sharing. I knew that everyone here was probably already doing incredible work, but we would love the opportunity to partner with you to further that work in any way we can. It's exciting to hear about all the things that are happening, especially the work with food security.
Yeah.
Oh, thank you, Brenda. She says all ages when supervised, and families and youth groups can also glean. I know my children have been very surprised by encountering where their food actually comes from. So I think it's for kids that don't have an opportunity to do that, it's a great thing.
Excellent. Do we have any other questions for Kim today?
Oh, and I will drop, just in case you all need it, my email address and our website.
Thank you. And we will definitely, so we'll send out the recording to everyone who registered for this webinar. We have a number of people who registered and they just received the recording. So they don't always have time to show up in the middle of the day. And so we will also have a list of some of the resources that haven't been identified during this presentation, as well as resources from Kim in that follow-up email, along with a copy of the recording. So yeah, thank you, Kim.
Thank you all. Thank you all so much for inviting us to be here and for sharing what you're doing. And we hope to hear from you all in the future. So.
Yeah. All right. If there are no more questions, we will have just what has become kind of a PHW tradition. We call it 3 deep breaths. And we'll invite you to just be in the space where you are, to take a moment. I'll invite you to take 1 deep breath and I'll count off the first one. And then you do the next 2. And then we will say goodbye for today. And you can unmute yourselves to say goodbye as well. So center yourselves wherever you are. Feel your body in the place where it is. I think focus potentially on the way that our bodies are made. Feel thankfulness or gratefulness for the body that you're in. First deep breath, 1. Amen.